I will be talking about fibromyalgia syndrome today. So, what is fibromyalgia syndrome? Fibromyalgia syndrome, or FMS for short, is a rheumatologic syndrome where the central sensitization and blunting of inhibitory pathways happen, as well as alterations in neurotransmitters of sensory signals in the central nervous system, which lowers the threshold of pain and amplifies normal sensory signals, which causes constant pain, stiffness, and tenderness in muscles, joints, and tendons. The basis for this syndrome are the regulations of the autonomic and neuroendocrine system that is caused by physical trauma, surgery, infection, or significant psychological stress. And in some cases, symptoms gradually accumulate over time with no single triggering event. It is also more common in women than men. Other than the usual pain, stiffness, and tenderness in muscles, tendons, and joints, there are many other symptoms for fibromyalgia syndrome, like restless sleep, tiredness, fatigue, anxiety, depression, disturbances in bowel functions, and changes in neuroendocrine transmitters, such as serotonin, substance P, growth hormone, and cortisol. However, despite causing chronic pain or potentially disabling body pain, fibromyalgia syndrome does not result in any tissue damage or deformity. When fibromyalgia syndrome strikes, it causes pain in certain areas, but strangely enough, the affected areas feel pain on both sides. For example, the shoulders are a very common place for FMS to appear, so when it does, it emerges on both the right and the left shoulder, and not only one of them. The same goes for the buttocks. Both the right and the left areas get affected. The arms also both get pain, and there's also the neck, chest, and upper back as popular body parts that get affected by fibromyalgia syndrome. To check if a patient is suffering from fibromyalgia syndrome, a physical checkup is required, where 4 kilograms of pressure is applied by an instrument called dolorimeter on the tender points of the body, where pain was said to be experienced for at least a week. When the patient confirms pain in the pressured area points, points are given on a scale from 0 to 3, according to the intensity of the pain, and this is called the Widespread Pain Index, or WPI. And that is applied to only one area, but when summed up with the other painful places on the body, it should sum up to from 0 to 12. And then it would be referred to as symptom severity, or SS. There are also laboratory testings that take place, such as complete blood count, or CBC, erythrocyte sedimentation rate, which is ESR, rheumatoid factor, RF, anti-nuclear antibody, creatinine phosphokinase, serum muscle enzyme, vitamin D, C-reactive protein, or CRP, renal functions, liver functions, X-rays, nuclear medicine, CT scan muscle biopsy, thyroid stimulating hormone, TSH, T3, and T4 that are also secreted by the thyroid gland. There are generally two ways to treat fibromyalgia syndrome. The first of which is the physical treatment that involves the intake of drugs, and I will talk about it more in detail in the next slide. The second method is the mental treatment, which is very vital for an FMS patient because it is directly linked to the cause and continuation of the syndrome. The person being treated should go to therapy and make sure that nothing is affecting their mental health. They are also advised to exercise as it has an effect that reduces stress and recharges the body's energy and energizes it. Physical treatment mostly consists of acupuncture, since the damage is more neurological than anything. So that is only to relieve pain. So acupuncture is from the Chinese medicine, where small needles are inserted on the body on special places called the tender points. And scientists have identified 18 of them for fibromyalgia. And they are two occiput, which are on the back of the neck, two on the elbows, two on the cervical, which is on the back, two suprapinatus, two on the second ribs, two on the lateral epicondyle, two on the gluteals, two on the greater trochanter, two on the knees, and those add up to 18. So when the acupuncture is put correctly, it will help release endorphins into the bloodstream, which is the body's natural pain relievers. And lastly, we have the drug treatment, which is called pharmacotherapy, and it includes pain relievers such as paracetamol, acetaminophen, and analgesics. There's also the growth hormone and NSAIDs, but NSAIDs can't relieve pain much because pain does not respond to them. Antidepressants are also given, like tricyclic antidepressants and selective serotonin reuptake inhibitors, also called SSRIs, and these two can be taken together. There are also duloxetine, which is a serotonin and neuropephrine reuptake inhibitor, and dopamine agonists like paramezole, and there's also sodium oxybate therapy and growth hormone therapy. Some Chinese herbs can also be used, like the Chinese herbal tea and Tai Chi. Thank you for listening, and sorry for stuttering a lot.